There's so many parts of getting a little older, now that I'm 35, that I really enjoy. I have a wonderful family life, I have a gorgeous son, supportive husband, a career that I love. But one thing that is on my mind a little more now are the actual results of aging. I'm doing everything that I can, but there's just those things that are just still starting to pop up. I have, this small line that has sort of always been there. I'm a really expressive person. I make a lot of facial expressions. I find that I'm taking more time in the morning, feeling self-conscious leaving the house without makeup on. I have tried another neurotoxin in the past. My husband, I'll make comments and he says, "Oh, you're crazy, you look great."
I like walking arm in arm down the street with her and having the heads turn and everything else. I think subtlety is key. I think that she wants to look her best without maybe people even knowing that she's doing something like this.
I don't want to look overdone. I don't want to look frozen. I want to look like myself. I'm very confident that when I leave my house and walk into Dr. Kaufman's office that I'll be in great hands.
Dysport is approved for the treatment of moderate to severe frown lines right between the brows. And what Dysport does is it causes muscle relaxation in the frown lines between the brows. We can inject Dysport and target those muscles specifically, so it won't affect your expression in the rest of the face.
How quickly do the results kick in? And once they do, how long will they typically last?
With Dysport injection, you could see results as fast as 2 to 3 days, and the results may last up to 4 months.
Seems like this would be a sensitive part of the face. Will it hurt?
It's 5 tiny injection points along your brow. You could have 5 little red dots, and that might last for about 15 to 20 minutes.
Is there anything in the days after the treatment that I should look for or expect?
Side effects are usually minor, but can include maybe a little bruise at the site of the injection, or a little tenderness, or even a headache.
So once the Dysport is injected, what is it actually doing?
Dysport acts like a neuromodulator, which helps relax specific muscles. And the ones we're looking at are the muscles between the brows. It helps improve those frown lines.
The procedure was so quick and easy, virtually painless, and now I'm just excited to see the results. The minimal downtime is so important. I'm a working mom. I don't have much time to spend on myself and to spend on things outside of work and my son and my responsibilities at home too. I was only in the office for maybe about 20 minutes and was able to return right to work.
It was something that was so subtle to me that if I wasn't told about it, I wouldn't even have known that she had a procedure done.
The lines between my brows are something that have bothered me for years now, and it's nice to not have that to worry about. Dysport was able to target just my problem area.
I think when you look good, you feel good, and that helps you play good, but just having that extra bit of confidence goes a long way for a lot of people.
Eventually, I might have more concerns down the road, but right now that really was my main concern, and it's nice to know that there are targeted treatments that can help with that.
Dysport is a prescription injection for temporary improvement in the look of moderate to severe frown lines between the eyebrows, glabellar lines, in adults less than 65 years of age. Important safety information. What is the most important information you should know about Dysport? Spread of toxin effects. In some cases, the effects of Dysport and all botulinum toxin products may affect areas of the body away from the injection site. These effects can cause symptoms of a serious condition called botulism. Symptoms of botulism can happen hours to weeks after injection and may include swallowing and breathing problems, loss of strength and muscle weakness all over the body, double vision, blurred vision and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, or loss of bladder control. Swallowing and breathing problems can be life-threatening, and there have been reports of death. The risk of symptoms is probably greatest in children treated for muscle spasms, but symptoms can also occur in adults treated for muscle spasms and other conditions, particularly in those patients who have underlying conditions that would predispose them to these symptoms. The toxic effects have been reported at doses similar to those used to treat muscle spasms in the neck. Lower doses, in both approved and unapproved uses, have also caused toxic effects. This includes treatment of children and adults for muscle spasms. These effects could make it unsafe for you to drive a car, operate machinery, or do other dangerous activities. Do not have Dysport treatment if you are allergic to Dysport or any of its ingredients. See the end of the medication guide for a list of ingredients. Are allergic to cow's milk protein, had an allergic reaction to any other botulinum toxin product, such as Myablock or Botox, or have a skin infection at the planned injection site. The dose of Dysport is not the same as the dose of any other botulinum toxin product. The dose of Dysport cannot be compared to the dose of any other botulinum toxin product you may have used. Dysport may not be right for you if you have surgical changes to your face, very weak muscles in the treatment area, your face looks very different from side to side, the injection site is inflamed, you have droopy eyelids or sagging eyelid folds, deep facial scars, thick, oily skin, or if your wrinkles can't be smoothed by spreading them apart. Tell your doctor all about your medical conditions, including if you have a disease that affects your muscles and nerves, such as amyotrophic lateral sclerosis, ALS or Lou Gehrig's disease, myasthenia gravis or Lambert-Eaton syndrome, allergies to any botulinum toxin product or had any side effect from any botulinum toxin product in the past, a breathing problem such as asthma or emphysema, swallowing problems, bleeding problems, diabetes or a slow heartbeat or other problem with your heart rate or rhythm, plans to have surgery, had surgery on your face, weakness of your forehead muscles, such as trouble raising your eyebrows, drooping eyelids, or any other change in the way your face normally looks. Patients with a disease that affects muscles and nerves who are treated with typical doses of Dysport may have a higher risk of serious side effects, including severe swallowing and breathing problems. Human albumin. This product contains albumin taken from human plasma. Steps taken during donor screening and product manufacturing processes make the risk of spreading viral diseases extremely rare. In theory, there is also an extremely rare risk of contracting Creutzfeldt-Jakob disease, CJD. No cases of spread of viral diseases or CJD have ever been reported for albumin. Allergic reaction to injecting in the skin. It is not known if an allergic reaction can be caused by injecting Dysport into the skin. The safety of treating excessive sweating with Dysport is not known. Common side effects. The most common side effects are nose and throat irritation, headache, injection site pain, injection site skin reaction, upper respiratory tract infection, eyelid swelling, eyelid drooping, sinus inflammation, and nausea. Tell your doctor all about the medicines you take, including prescription and non-prescription medicines, vitamins and herbal and other natural products. Using Dysport with certain other medicines may cause serious side effects. Do not start any new medicines while taking Dysport without talking to your doctor first. Especially tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myablock, Rimabotulinum toxin B, or Botox, Onabotulinum toxin A in the past. Be sure your doctor knows exactly which product you've received, have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, or take a sleep medicine. Use in specific populations. Dysport should not be used in children or in women who are pregnant or breastfeeding. Ask your doctor if Dysport is right for you. You're encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see Dysport full prescribing information, including medication guide.